Now, a lot of people have high blood pressure, but they don't know it. High blood pressure or hypertension is dangerous because there's often no symptoms. Dr. Brent Wallis from People's Health joins us now to share facts you need to know for High Blood Pressure Education Month. Good morning, Dr. B. How are you?
Hey, Tommy. Good morning.
Will you be heading back to Jazz Fest this weekend?
I think I'm going to try to make it over there, but it is going to be hot. Got to drink a lot of water.
Hydrate. Water, liquid, not booze.
Yeah, beer is not hydration.
You know that. I'm just saying it for the audience. Let's talk about blood pressure in general. Can you just start by explaining what that is?
Yeah, sure. So blood pressure is it's the force of the blood going through your arteries. And we measure it with two numbers, so that's why you'll always see one number over another. The top number is called a systolic blood pressure, and the bottom number is called a diastolic pressure. And the reason there's two numbers is because your heart beats, right? So whenever your heart beats and pushes the blood forward, it exerts a pressure on the blood vessels in your body, and that's that top systolic number. When the heart relaxes, the blood continues to flow, but just not as forcefully, so that's called the diastolic pressure. And both numbers are very important because the more your heart has to pump and the more strength it uses to pump, or the narrower your arteries are, the higher your blood pressure is going to be. So
what is a good blood pressure reading?
Yeah, pretty simply, it's anything below 120 over 80. Anytime you get the top number or the bottom number higher than that, it's something that we get a little bit concerned about and we watch. So typically the top number, the systolic number, when it's between 120 and 129, we call that elevated blood pressure. It's not true high blood pressure at that point, but it's something we have to keep an eye on. Once you get into the 130s, that's true high blood pressure, and then 140s and above is actually more severe high blood pressure. The one thing I tell people, you go to the doctor, we check your blood pressure, we may get a single reading that's high. That doesn't automatically mean you have high blood pressure, but it does mean you need to get your pressure checked again. It's a sign that you really need to watch what's going on.
If you can just being nervous because you're going to the doctor in and of itself cause higher blood pressure?
Yeah, it definitely can. We call it white coat hypertension. So when you see our white coats, sometimes you get nervous, which is normal. The problem is with some people, you may get nervous with a lot of situations. And if your blood pressure is spiking like that, that can be just as bad. So it's not something to completely dismiss.
And then when you couple that with no symptoms for high blood pressure, how do you know if you have it if that's the case?
Yeah, it is tough. Most often high blood pressure, especially in the early stages, doesn't cause any symptoms at all. And so that's why it's so important to go see your doctor. Make sure that you're getting regular checkups. So blood pressure is taken or should be taken as a part of every exam. Usually when you go in to see your doc, they're going to check your blood pressure and then put you in the room. And high blood pressure is very common, which is why we look for it all the time. About 1 in 3 Americans has high blood pressure, and that increases pretty dramatically when you go over age 65 to about 70% of our seniors have high blood pressure. So, I tell people if you're putting off going to the doctor, especially if you haven't seen your doctor in a couple of years, you really should make an appointment to go in because you could be walking around with high pressures and not really realize it. And you want to know much sooner than later so that we can address it and keep it under control.
How does that affect your health, Doc, high blood pressure?
Yeah, high blood pressure causes all sorts of problems. If uncontrolled, that increased pressure pushing on the vessels can cause damage to the blood vessels or to the organs, that they're supplying blood to. And so it really increases your risk for a lot of health problems. Things like heart attack and stroke, even heart failure can be caused by heart pressure, with high blood pressure. And then another piece to kind of keep in mind, there are a couple of other medical conditions you can have, thyroid problems or kidney problems or even diabetes that may actually lead to high blood pressure or exacerbate it as well. So, again, that's why it's important to identify it, try to figure out the cause and see what you could do to improve it. And don't be discouraged. One thing I do tell people, we don't always find a direct cause for high blood pressure. Sometimes the blood pressure is what we call essential, meaning we just don't know the exact cause of it. It's just so prevalent that sometimes it is what it is, and we just have to treat it.
Let's take a quick break. We'll come back. We'll talk about who's at higher risk for high blood pressure. We're talking to Dr. B, Dr. Brent Wallis from People's Health, Chief Medical Officer, and we're talking about High Blood Pressure Education Month. Keep you healthy. It's simple to treat, but serious consequences if it goes untreated. 8:20, time for traffic now on WWL. 8:25, Tommy Tucker, WWL. Talking to Dr. B, Dr. Brent Wallis, Chief Medical Officer with People's Health. It is High Blood Pressure Education Month. I think it's something, Doc, correct me if I'm wrong, it's pretty easy to treat, but very, very serious if it goes untreated.
Yeah, extremely. Like we were saying, it can have so many consequences, especially to your cardiovascular health, so it's critical to get treated.
Who is at higher risk for high blood pressure, if anybody?
Well, yeah, like I said, age definitely increases your risk. We see it a lot more often in our seniors. But also family history plays a huge role. So if you've got a brother or sister, mom or dad who's got high blood pressure, there's a pretty high chance that you're going to have troubles later in life. Race actually plays a huge role as well. More than 40% of African Americans have high blood pressure, and that goes up dramatically as they get older as well. And they actually tend to have earlier diagnoses and more severe cases of high blood pressure. And then certainly being overweight or physically inactive causes problems. Smoking is a huge risk factor for high blood pressure, as is excessive alcohol drinking. And then in particular, diet plays a pretty big role. Too much salt can cause a lot of problems. And then if you have other conditions like diabetes or kidney disease, like I mentioned, that can lead to high blood pressure as well.
What about lifestyle changes? Can that help you control your high blood pressure?
Yeah, you want to address those risks that I was talking about. Try to keep your weight at a healthy level. You really need to try to eat a balanced diet. Make sure you're eating fruits and vegetables and whole grains, lean meats, not a whole lot of fast food, and exercise. 30 minutes at least 5 times a week is really recommended. And if you're smoking, we can't say this enough, you've got to quit smoking, and because that will lower your blood pressure, and then reduce your alcohol intake as well.
All right, so what about some foods to avoid if you have high blood pressure?
Well, like I mentioned, salt really affects your blood pressure. So, what happens when you eat, you probably know this, you eat a salty meal and you feel a little bit puffy. And what that means is that you're holding on to more water, and when you hold on to more water, it increases the amount of blood volume you have, and it makes it harder for your heart to pump everything around. So that actually can increase your blood pressure. So you don't ever really want to add salt if you can get away with it. I tell people just put the salt shaker in the pantry. Don't even think about it. You talk to your doctor about salt substitutes, because those can be used, but they contain potassium. So people with kidney disease or diabetes may have trouble with that. So don't just pick those up. And then, keep in mind, salt is not just something you add to meals. It's actually used to preserve things. So any foods that are prepackaged or cans, things like soups and meats, those all have a tremendous amount of salt. A lot of people don't realize salted butter actually has a tremendous amount of salt. And then obviously fast food and chips and pickles, all of those are not good for your blood pressure. And unfortunately, even though we eat a ton of it here in Louisiana, boiled seafood or gumbo, that has a lot of salt. So while you may not be able to totally exclude it, you want to watch your portion size.
And what about if you're taking medication for high blood pressure?
Yeah, we do use a lot of medications for blood pressure. Sometimes we have to use multiple types to get your blood pressure under control. So the big thing I tell people with that is make sure you take it as prescribed. Don't skip doses. And in particular, when you start taking your medicine, you feel better. You feel a whole lot better. And so some people say, well, I don't need to take the medicine anymore. And that's absolutely false. You're feeling better because you're taking the medicine, so you want to make sure you stay on it. That's absolutely critical.
Lord knows I've never done that, Tommy says, rolling his eyes.
Very
Thank you, Dr.
common.
B. Yep, appreciate your time. Have a great weekend. I hope you enjoy Jazz Fest, and happy Mother's Day to your wife. If you want to find out more about People's Health, go to peopleshealth.com. You can visit the People's Health United Healthcare Medicare Center at 3017 Vets in Metairie, next to Party City. Appointments are recommended, but walk-ins are welcome. You can call 1-800-978-9765, and it's easy to follow People's Health on Facebook, Twitter, and Instagram.